Hey guys, we have a bunch of things that are changing, mostly terminology with Epic Go Live. We just wanted to make sure everybody was not caught off guard by the little bit of practice changes and different things happening on Saturday, in addition to the entire system changing. So ASQ is the suicide screening. We will have to ask those questions for everybody 12 and up. We're going to have a laminated card that when the patient gets back to the room, you can just have them fill it out and then you can transcribe it into the computer, and then it'll prompt you if you need to go get a physician based on their answers. The FACES pain scale is now a whole bunch of different pain scales, different based on the patient's age. Those IPAT, FLAC, most of these are things we're familiar with. There's a dementia one, a nonverbal pain scale, so there's a lot of different options in there. The MRN, just a name change, so it is still an MRN, but they might call it an XMRN, a Unified Medical Record Number, or a CSN, which is a specific encounter number. So those are the other terms if you're on with IT and they ask you about that. And then the other big one is a child abuse screening. You'll have to do a child abuse screening on every patient 47 months or less. There's one that you do from 0 to 5 months, and then one from 6 months to 47 months. This is unfortunately not going to be a prompt from iCentra, at least initially. We've of course asked for that. There is going to be a little workflow aid on the computers that will be by age. So all the weird things you have to do for this age will be in one section, and so on and so forth. So hopefully we can make that a little easy to work with.
And then the last couple is the sedations. The NAMDU that we've always used is going to switch to the UMSS, the University of Michigan Sedation Scale. And then we've always used the Aldrete, like modified Aldrete. We're going to use that for part of it. And then the other part's going to be PADS, which is post-anesthesia discharge sedation scale. I know it's a lot. We'll make a new checklist. We're getting more information about that this end of this week, and so we'll send that out when that comes. And then it's rare, but insulin drips, they have a platform. It's called Glucose Stabilizer, where you input the patient's glucose and it tells you what to change their IV pump to. We do it so infrequently that we didn't feel it was important to really educate you now, but we will have resources available after go live that will help us navigate that. And then for the modified pediatric Glasgow coma score that we've always used, that will be transitioning to the Adelaide pediatric coma scale. And then the bedside swallow screen that we've always used will switch to the Yell swallow screen.
Basically the same.
Different name.
Yeah.
And then paper consent. So you'll notice that a lot of that will be made electronic. So things like procedural consents, blood consents, EMTALA transfer forms, AMAs, left without treatment, those will all live as an electronic version in the computer system. Blue sheets and pink sheets will still remain as paper.
A lot of these, if it needs a separate video for it, we will do the video, but we can't get into it until production because like Glucose Stabilizer doesn't work in Playground. So when production comes out, we can get it out. We'll do a video and then we'll send that out with a QR code and stuff. So we'll both be here. Anything that's hard or weird about it, when we actually get to see it in production, we'll try to send more information out as fast as we can. Okay.
Thanks, guys.